Hi, Assalamualaikum. My name is Muhammad Aizat bin Abdul Rahim. My metric number is 255145. Today, I'm gonna present to you about the simulation for queuing system at hospital emergency department. Now, moving on to the chapter 1. In chapter 1, the background of the study. Hospital is a place where patients who suffer any disease or involved in any accident to get treatment. Medical service nowadays play an important role in any service provided because it was well related with human health condition. Service such as the consultation with the doctor, medicine and medical operation and the person behind the counter to serve you were part of the hospital. Therefore, it is represent the hospital that they've been working. Careless awareness about the medical service might cause death and in most of the case can cause harm and reduce the life expectancy of the patient. Therefore, it is the aim of this study to application of waiting line queue at the hospital and at the same time help the hospital to improve their service that can benefit not only the hospital itself but to other people who need medical service. The problem statement. The first one is patient have to wait for a long time in queue to get their medical service. The second one is patients are not satisfied with the service provided. And the third one is lack of medical staff and people in the counter. My research question is, at what time the waiting line at the hospital is at maximum capacity? What can be done to minimize the number of people in the waiting line? And how can the service at the hospital can be improved? My research objective is to develop a hospital queuing system model to determine the total waiting time taken in the hospital by the simulation, and lastly to determine the average time taken by the patient waiting at the hospital. And now moving on to the literature review. The first one is the mathematical approach. Kalula, Kelly, and Abdullah model of the pathway of the patient require knowledge of probability distribution law followed by the arrival of the patient and service question. Diaz in 2006 said that process of patient arriving follow the Poisson distribution while the medical service follows the exponential law. The service concept. Patients start arriving at the clinic at 8 a.m. and go directly to the registration to take number. And then the patient will check by the medical assistant to see if they are critical or not. Patients have to wait until their turn to receive a consultation from the doctor. After receiving the medical consultation, a patient may leave the hospital. The problem faced in waiting line queue. General patient or ordinary patient waiting time in queue is longer compared to emergency patient. Doctor and nurse, or we can call it as medical professional, and the patient have struggled with a long waiting time in surgery for decades. Problem faced by waiting line queue in hospital is the demand rate for the healthcare service and big crowds around Department of Radiology. Overcrowding in private hospital emergency department is significant, especially in the urban and rural setting. Result that always been delay, increasing error in medical service and long waiting time had caused the patient dissatisfaction toward the hospital service, thus increasing the problem for the hospital. The improvement for the quality of healthcare and the operation performance and the patient satisfaction has been a problem related to the hospital waiting line. Now we move to methodology. In research population, the study population consists of all the patients on the queue for service in the front of the medical facility at peak hours, on days and off-peak hours in one day at Thompson Hospital in Kota Damansara. The conceptual model formulation or phase of conceptual model development. Patient arrive at the counter system at random point in time to seek for medical service in doctor room also in random manner. The counter system operates in such manner that for each arrival, if both doctor room are busy, then the patient enters a queue, else the arriving patient immediately enters the service. As patient depart, one or both doctor room becomes idle as a patient is selected from the queue to enter service. This will be modeled by using computer simulation for arena. For the data collection, the data used is the primary data. The data collected for simulation model is the arrival time, service time, and departure time. We observe the number of patients in the queue for their arrival and departure time. The procedure was recorded using time watch for the same time in each day. For the model assumption, we use the first come first serve basis. The arrival time of the patient is random, including the service time. Identical service offer since the same kind of service is given in both doctor room. And now we move on to the finding and discussion. As you can see, this is the flow chart for patient process flow in emergency department in the green zone. The simulation process starts from 8 a.m. to 4 p.m. All patients arrive at random time and the arrival time of the patient is not fixed. The patient arrive and need to register before getting their medical service. Then the patient will be diagnosed by the medical assistant to determine either the patient is critical or non-critical type. If the patient is critical, they will be referred to the first consultation room, designated specially for critical patient, and if not, is the second consultation room. The doctor then will prescribe either the patient need medication or they have to leave the facility. And now to the fitting distribution, patient arrival and process service time. For the service time, it can be categorized as four main processes, which are registration, pre-medical checkup by medical assistant for normal underscore case patient, doctor consultation for normal underscore case patient, and doctor consultation for urgent case patient. And now we move on to the basic case scenario. This is the model for the hospital emergency department, the basic case model. Add resources provided for base scenario, which consists of 2 receptionists, 3 medical assistants, 2 doctors for urgent consultation and 1 doctor non-urgent consultation. The patient enters and queue at the receptionist counter for registration and collect queue number. Patient with urgent case will be routed to the urgent case and consultation room. The non-urgent case patient will be queuing for the pre-medical checkup by medical assistant before proceeding to the consultation room. In the run setup, we can see that we set it to the 8 minutes to 8 hours. Base time unit is minutes, so the minute will be 480 minutes. So this is the result for the basic case scenario. This is the arena simulation result for the basic case scenario. There's a average waiting time and the number of queue. Okay, now we move on to the case scenario 1. This is a simulation model for case scenario 1. In this scenario case 1, from the run-based scenario result, it's shown that there are many queue at the registration and urgent case concentration process. To cater for this situation, an additional resource has been added by increasing number of receptionists and urgent case doctor by 1 respectively. The average waiting time for critical consultation room 1 decreased from 35.33 minutes to 9.611 minutes. But for non-critical consultation room, there are no change in the waiting time. Okay, this is the arena simulation result for the case scenario 1. It consists of average waiting time and the number of queue. And now we move on to the case scenario 2. This is the arena simulation model for case scenario 2. Run result from the scenario case 1 show they are queuing at non-critical consultation room 1 and additional resources was added to the non-urgent case consultation room 1 to minimize the queue and average waiting time taken. The model was developed here and run according to the knowledge that has already been updated. The average queue and waiting time for each process. The average waiting time for non-critical consultation room decreased from 26.262 minutes to 5.9269 minutes. Okay, now we move on to the result of the case scenario 2. This figure shows the arena simulation result for scenario case 2, the average waiting time taken and the number of queue. And now to the conclusion and recommendation. For the conclusion, the significant and the less time taken in waiting time indicates that the hospital management should give more emphasis to the operation of patient flow by implementing changes to the existing system. This is to ensure the high quality of services is delivered as well as to maintain the loyalty of the patient. For the recommendation, two proposed experimentation model can help reducing the waiting time for a patient. Scenario 1 improvement implemented on the model by adding 1 doctor to the critical consultation. From this improved model, the average waiting time is reduced for the other 2 critical consultation queuing waiting time. A scenario 2 improvement implemented on the model by adding 1 more doctor for the non-critical consultation. It also automatically reduced the whole average waiting time and overall time taken to finish the treatment. That's all from me. Thank you very much.